After more than 10,000 heart surgeries, I have learned something that no textbook alone can ever fully teach you. You do not truly understand the human heart until you have held it in your hands, until you have seen it struggle to keep a body alive, until you have watched a life hang in the balance on an operating table while seconds feel like hours. And if there is one truth I want people to understand more than anything else, it is this. Heart disease does not arrive suddenly. It does not appear out of nowhere like a thief in the night. It is built quietly, slowly, and often invisibly over many years of choices, habits, and neglect. When a patient comes to me after a heart attack, their first question is almost always the same. Doctor, why me? It happened so suddenly. But what they don't see is the long story behind that moment. The blocked artery did not become blocked overnight. It was not a sudden accident. It was the final chapter of a story that may have started 10, 15, sometimes 20 years earlier. Every meal high in processed fats, every skipped walk, every cigarette, every ignored warning sign from the body, these are not isolated actions. They are building blocks, quiet ones, invisible ones, but powerful enough to reshape a human life. I often tell my patients that the heart is patient, but it is not forgiving forever. It compensates, it adapts, it works harder when you treat it poorly. You may feel nothing for years, even decades, while damage is silently accumulating. That is the most dangerous part of heart disease. It does not always hurt when it is forming. By the time pain arrives, the condition is often already advanced. Many people believe heart disease is something that just happens when you get older. But age alone is not the true cause. I have operated on young adults in their 30s with severe blockages, and I have seen elderly patients with surprisingly clean arteries. The difference is not luck. It is lifestyle over time. It is what was added to the body and what was denied from it. Movement, nutrition, sleep, stress management, these are not small details. They are the architecture of cardiovascular health. The tragedy is that the early signs are often ignored because they are subtle. A little fatigue, a mild tightness in the chest during exertion, shortness of breath when climbing stairs. People explain it away. I'm just tired. I'm getting older. It's nothing serious. But in medicine, I have learned that nothing serious is sometimes the most dangerous phrase a person can say to themselves. Because by the time it becomes serious enough to demand attention, the disease has already progressed significantly. There is also an emotional pattern I see repeatedly. Life becomes busy, stressful, overwhelming. Health gets pushed aside. People focus on work, family responsibilities, financial pressure. They promise themselves they will take care of their health later. But later has a cost. The body does not pause its aging process while life is busy. The arteries do not wait politely for you to be ready. What makes heart disease so deceptive is that the body is remarkably resilient. It can function even when arteries are narrowed. It finds temporary workarounds. It adapts quietly, so a person can feel fine while significant disease is developing inside them. This false sense of security is what leads many people to their first diagnosis being an emergency. I remember one patient vividly. He walked into my clinic smiling, no major complaints, just a bit of occasional fatigue. He said he thought it was stress. He was successful, active in his business, always on the move. But tests revealed severe coronary blockage. When I explained the situation to him, he was shocked. He said, "But I feel okay." That sentence is something I have heard too many times in my career. Feeling okay is not always the same as being okay. And so I began to understand something deeper about prevention. It is not dramatic. It is not loud. It does not demand attention the way emergencies do. Prevention is quiet discipline repeated over years. It is choosing consistency over convenience. It is understanding that the heart does not respond to occasional effort. It responds to sustained care. What I want people to realize is that heart disease is not simply a medical event. It is a timeline, a long one, and every person is writing their own version of it every day, whether they are aware of it or not. The food choices you make today are not just about today. The movement you do today is not just about today. The stress you carry, the sleep you neglect, the habits you repeat. These are all messages to your future heart. As a surgeon, I can intervene at the final stage. I can restore blood flow. I can open blocked vessels. I can give someone a second chance, but I cannot rewrite the years that led them to me. That part is not done in the operating room. That part is done in everyday life, long before I ever meet the patient. So when I say heart disease is built over time, I say it with both concern and hope. Concern, because many people are unaware of how early the process begins. Hope, because it also means that real change, has power if started early enough. The same years that build disease can also be used to prevent it. And that is the message I leave with every person who will listen carefully enough to hear it before it becomes urgent in their life. The heart remembers everything you do to it, long before it ever calls for help. When we talk about cholesterol, I often see fear in people's eyes, as if it is something purely evil, something that must be eliminated from the body at all costs. But in more than 10,000 heart surgeries, I have learned that nature is rarely that simple. The human body does not create waste without purpose. Cholesterol is not a poison. It is not an enemy waiting to destroy you. In fact, without it, life itself would not exist. Every cell in your body depends on cholesterol to maintain its structure. Your hormones depend on it. Your brain depends on it. Even your ability to heal depends on it. So the problem has never been cholesterol itself. The problem begins when balance is lost. In the bloodstream, cholesterol travels in different forms, carried like passengers in vehicles. Some of these vehicles are helpful, and some are dangerous when they are in excess. Low-density lipoprotein, what we commonly call LDL, is often described as bad cholesterol. But even that label can be misleading if misunderstood. LDL is not inherently bad. It becomes harmful only when there is too much of it circulating for too long, especially in the presence of other risk factors. When the system is overloaded, LDL particles begin to deposit along the inner walls of the arteries. Slowly, silently, they start to build layers. On the other hand, high-density lipoprotein, HDL, is often called good cholesterol. Its role is protective. It helps transport excess cholesterol away from the arteries and back to the liver, where it can be processed and removed. You can think of HDL as a cleanup system, constantly working in the background. When HDL levels are healthy, the body has a better chance of maintaining clean, flexible arteries. But when HDL is low, that protective system weakens. Now here is where many people misunderstand the story. They think heart disease is simply about having high cholesterol numbers. But in reality, it is about what happens to cholesterol over time inside the body. A single blood test is only a snapshot. It is not the full movie. I have seen patients with borderline cholesterol who suffer heart attacks, and others with high cholesterol who live without major cardiac events. Why? Because cholesterol does not act alone. It interacts with inflammation, blood pressure, blood sugar, smoking, stress, and genetics. It is part of a much larger system. When LDL particles enter the artery wall and become trapped, the body recognizes them as something that should not be there. This triggers an immune response. White blood cells arrive to clean up the area, but over time, this process itself becomes harmful. The immune response leads to chronic inflammation, and inflammation, when persistent, damages the inner lining of the arteries. The vessel becomes rough instead of smooth. Once that happens, more cholesterol sticks, more inflammation develops, and a cycle begins. This is how plaques are formed, not in a moment, not in a day, but gradually over years. These plaques are not static. They grow, they harden. Sometimes they remain stable for a long time, causing no symptoms at all. But sometimes, without warning, they rupture. And when they rupture, the body reacts as if there is an injury. A blood clot forms quickly over the rupture. That clot can suddenly block blood flow to the heart muscle. And that is what we call a heart attack. What makes this process so dangerous is its silence. There is no alarm when plaque is forming. There is no pain when arteries begin to narrow slowly. A person can feel completely normal, while significant disease is developing inside them. This is why I always emphasize that cholesterol is not something to be judged only by fear or numbers alone, but by understanding its role in a larger biological story. We must also understand that modern lifestyle has changed how cholesterol behaves in the body. It is not just diet in isolation. It is diet combined with inactivity, stress, poor sleep, and metabolic conditions like diabetes. When the body is under chronic stress, hormones shift. Inflammation increases. Blood vessels become more vulnerable. Even cholesterol that might otherwise be manageable can become dangerous in that environment. But I want to be very clear about something important. Cholesterol is not a myth. It is not a lie. It is a real and measurable factor in heart disease. What is misleading is the oversimplification of it. People are often told only to reduce cholesterol, as if that alone solves the problem. But the truth is more complex and, at the same time, more empowering. Because if the problem is multifactorial, then the solution is also multifactorial. When I speak to patients, I tell them not to think of cholesterol as an isolated enemy, but as part of a system that reflects how they live. It reflects what they eat consistently, not occasionally. It reflects how active they are over months and years, not just a few days. It reflects whether their body is in a state of chronic inflammation or balance. It reflects their metabolic health as a whole. There is also an emotional aspect that many people overlook. Stress, long-term emotional strain, and lack of rest can influence cholesterol metabolism and inflammation. The heart does not live separate from the mind. The body responds to what the mind endures. I have seen patients under extreme stress develop worsening cardiac conditions, even when other factors seemed controlled. So when we talk about cholesterol, we are really talking about balance. A balance between production and removal, between inflammation and healing, between damage and repair. When that balance is maintained, cholesterol is not a threat. When it is disrupted over time, it becomes part of a larger process that leads to disease. As a surgeon, I see the end result of imbalance. I see blocked arteries. I see weakened heart muscles. I see emergencies that could have been prevented. And I also see the quiet opportunity that many people still have before it reaches that point. So I always remind people, do not fear cholesterol blindly. Understand it, respect its role, and more importantly, understand the environment in which it operates inside your body. Because cholesterol does not act alone, it simply reveals the story your body has been living all along. When I look back at more than 10,000 heart surgeries, there is something I have come to understand very clearly, and it often surprises people when I say it. The most dangerous force in heart disease is not always cholesterol alone. It is inflammation. Silent, persistent, and often invisible inflammation inside the arteries. If cholesterol is the material that builds the problem, inflammation is the fire that shapes it, strengthens it, and sometimes destroys everything without warning. Many patients imagine their arteries as simple pipes that get blocked like a drain in a sink. But the reality is far more complex and far more biological. The inside of an artery is living tissue. It responds to injury, stress, toxins, and metabolic imbalance. When that inner lining is healthy, it is smooth and protective, allowing blood to flow effortlessly. But when it is repeatedly exposed to damage, it changes its behavior. It becomes irritated, and that irritation is what we call inflammation. Inflammation is not always a bad thing. In fact, it is one of the body's most important defense mechanisms. If you get a cut on your skin, inflammation is what brings healing cells to the area. It protects you. It repairs you, but the problem begins when inflammation does not turn off, when it becomes chronic, when it continues silently for years inside the arteries without any visible sign on the surface. Now imagine this happening inside your blood vessels. Every time LDL cholesterol enters a weakened or irritated artery wall, the body treats it like an intruder. Immune cells rush in. They attempt to remove it. But instead of resolving the issue, the process repeats itself again and again. Over time, this creates a chronic inflammatory environment. The artery wall thickens. It becomes less flexible. And slowly, plaque begins to develop. What is important to understand is that this process is not only about cholesterol levels. It is about how the body reacts to cholesterol. Two people can have similar cholesterol readings, but completely different levels of inflammation. And that difference determines risk more than most people realize. Inflammation is influenced by many factors. Poor diet plays a role, especially diets high in processed foods, sugar, and trans fats. But it does not stop there. Lack of physical activity increases inflammatory markers in the body. Chronic stress also plays a major role. When the body is under constant stress, it releases hormones like cortisol in high amounts. Over time, this alters immune function and increases inflammation. Even poor sleep contributes because the body does much of its repair work during deep rest. Without it, inflammation has more time to build up unchecked. There are also medical conditions that intensify inflammation, such as diabetes and obesity. In these conditions, the body is already in a heightened inflammatory state. That is why patients with diabetes are at significantly higher risk of heart disease, even if their cholesterol numbers appear only moderately elevated. The internal environment matters just as much as the numbers on a report. One of the most dangerous aspects of inflammation in the arteries is that it does not announce itself loudly. There is no sharp warning in the early stages. A person can walk around feeling completely normal, while their blood vessels are undergoing slow structural changes. The plaque that forms under inflammatory conditions can remain stable for years, but it becomes vulnerable when inflammation increases suddenly. That is when rupture happens. That is when a heart attack occurs. I have seen this pattern many times in emergency situations. A patient who seemed fine the day before suddenly arrives with chest pain, and within minutes we are fighting to restore blood flow to the heart. When we examine the arteries, we often find that the blockage was not simply a buildup that grew overnight. It was a long-standing plaque that became unstable due to inflammation, and that instability triggered a sudden event. This is why I always emphasize that heart disease is not just about blockage. It is about stability. A partially blocked artery that is stable can sometimes exist for years without causing an emergency. But the same artery, if destabilized by inflammation, can become life-threatening in an instant. The difference is not always the size of the blockage, but the condition of the tissue around it. Modern research has increasingly supported what we see in surgery. Markers of inflammation in the blood, such as C-reactive protein, can sometimes be better predictors of heart risk than cholesterol alone. This does not mean cholesterol is irrelevant. It means the story is broader. The heart is influenced by multiple systems working together, and inflammation sits at the center of many of them. What I want people to understand is that reducing heart risk is not only about lowering numbers on a chart. It is about changing the internal environment of the body. When inflammation is reduced, arteries become more stable. Plaques become less likely to rupture. Blood vessels function more smoothly, and the entire cardiovascular system becomes more resilient. This is where lifestyle becomes powerful in a way that medicine alone cannot always replicate. Regular physical activity reduces inflammation at a systemic level. A balanced diet, rich in natural foods, supports vascular health. Proper sleep allows the body to repair itself. Stress management helps regulate hormonal balance. These are not abstract wellness ideas. They are direct biological interventions that influence inflammation inside the arteries. Even medications used in cardiology often aim not only to lower cholesterol, but also to stabilize plaques and reduce inflammation. Because in the end, the goal is not just to clean the bloodstream. It is to calm the biological storm that can exist within it. So when I speak about heart disease, I do not speak only about cholesterol numbers or blocked arteries. I speak about an environment inside the body that either supports health or slowly undermines it. Inflammation is that hidden environment. It is the silent force that determines whether a plaque remains quiet or becomes dangerous. And if there is one truth I have learned on the operating table, it is this: the heart rarely fails without warning from the body's internal environment. It only becomes dangerous when that environment has been disturbed for far too long. Because in the end, inflammation is not just part of heart disease. It is often the spark that decides its outcome. After spending more than 10 surgeries inside operating rooms, I can't tell you something with absolute certainty that no technology, no instrument, and no emergency intervention can replace. Prevention will always be more powerful than surgery. Every single time, and I say this not to diminish what we do as surgeons, but to reveal the truth that I have witnessed again and again on the table. By the time a heart reaches me in an emergency condition, the story has already been written long before my hands ever touch it. People often imagine that modern medicine is about fixing problems when they appear. And yes, we do that. We open blocked arteries, we restore blood flow, we save lives in critical moments. But what many do not realize is that surgery is not a cure for years of damage. It is an intervention at the final stage of a long process. It is a second chance, not a reset button. I have seen patients who believed that medicine alone could undo everything, that they could live without discipline, without lifestyle changes, and rely entirely on treatment when things go wrong. But the human heart does not work that way. It responds more to daily habits than to emergency solutions. It remembers consistency far more than it responds to last-minute correction. Prevention begins in places that are not dramatic. It begins in what you eat when no one is watching. It begins in whether you choose to move your body when it feels inconvenient. It begins in how you handle stress when life becomes overwhelming. It begins in how seriously you take small warning signs before they become big emergencies. These are not medical moments in the traditional sense, but they are the true foundation of heart health. When I meet patients after surgery, one of the most important conversations I have is not about what I did in the operating room, but about what they must do afterward. Because even after a successful procedure, the body returns to the same environment that created the problem in the first place unless that environment changes. Surgery clears the blockage, but it does not automatically change the habits that caused it. This is where prevention becomes the real treatment. Prevention is not a single action. It is a continuous way of living. It is not something you do for a week or a month. It is something you build into your identity over years. It is in the rhythm of your choices, the food you repeatedly choose, the movement you repeatedly practice, the rest you repeatedly protect, the stress you learn to manage instead of absorb. I often tell people that the heart is not impressed by intensity. It is impressed by consistency. A sudden burst of healthy behavior followed by long periods of neglect does very little. But small, consistent discipline over time creates powerful protection. A daily walk repeated over years can do more for your heart than a short burst of extreme effort followed by inactivity. A balanced diet maintained steadily will protect you far more than occasional strict dieting followed by indulgence. What I have learned in surgery is that most emergencies are not truly sudden. They are the result of ignored signals. The body speaks quietly long before it shouts: mild fatigue, occasional discomfort, reduced stamina. These are not dramatic symptoms, but they are messages. Prevention is the ability to listen when the body speaks softly, not only when it screams. There is also something deeply important about mindset. Many people approach health only after fear appears. After a diagnosis, after a scare, after a loss in the family, but fear is not a sustainable strategy. It may create short-term change, but it rarely builds long-term discipline. Prevention, on the other hand, requires awareness without panic. It requires respect for the body without waiting for crisis. In my years as a surgeon, I have also seen the emotional cost of preventable disease. The regret, the "I wish I had known earlier," the "I thought I had more time." These are words that echo in hospital rooms more often than people realize. And they are heavy words because they come after the moment when prevention is no longer enough. But I also want to be clear about hope. Prevention is not about perfection. It is about direction. It is not about never making mistakes. It is about consistently moving toward healthier choices more often than not. The body is remarkably responsive when given the chance. It adapts, it heals, it strengthens when the conditions support it. Every patient I operate on teaches me the same lesson again and again. The best outcome is not the successful surgery. It is the life that never needed one. That is not just a medical truth. It is a human truth. Because nothing I do in the operating room can compare to the power of a life lived in a way that avoids reaching the operating room in the first place. So when I speak about prevention, I am not speaking as an abstract concept. I am speaking as someone who has seen both sides of the story. I have seen the moment when intervention is necessary, and I have seen the possibility of never needing it at all. And if there is one message I want to leave with you, it is that your daily choices are not small. They are not insignificant. They are shaping the condition of your heart far more than you may realize, because in the end, the greatest surgery is the one that never has to happen.